Your kidneys may be sending warning signs, and you might not even notice. Kidneys are silent workers in your body, tirelessly filtering toxins, balancing fluids, and keeping your blood pressure under control. Yet, when they start to fail, the signs are often subtle, so subtle that many people ignore them until it's too late. Today, we are going to uncover 10 silent warning signs that your kidneys may be shutting down. Some of these might surprise you, and others might explain symptoms you've been dismissing for years. If you value your health and your life, you'll want to stay with me until the very end, because ignoring these signs could cost you far more than you imagine. Subscribe to the channel and stay informed about your kidney health. What exactly do kidneys do, and why should you care? These two bean-shaped organs, each about the size of a fist, quietly handle some of the most vital tasks in your body. They filter waste products from the blood, balance electrolytes like sodium and potassium, and even regulate blood pressure. Without healthy kidneys, the entire body falls out of balance, and the effects are felt everywhere. Kidney failure doesn't happen overnight. It's usually the result of years of silent damage. Diabetes and hypertension top the list of culprits, slowly wearing down the delicate filters inside the kidneys. Many people don't even realize their habits, like skipping water or relying on processed foods, are setting the stage for kidney disease years later. Another hidden danger is medication misuse. Over-the-counter painkillers, especially NSAIDs like ibuprofen, can harm the kidneys if taken too often or in high doses. They reduce blood flow to the kidneys, making it harder for them to function. It's a common mistake. People think, it's just an over-the-counter pill, it can't hurt me, when in reality, it can. Dehydration is another enemy of kidney health. When the body lacks water, the kidneys have to work overtime, concentrating urine and straining the filters. Over time, this stress can cause microscopic damage, leading to bigger problems. That's why doctors repeat the same advice. Drink enough water, not as a cliché, but as a life-saving habit. Chronic conditions add fuel to the fire. Diabetes, high blood pressure, and heart disease often travel together, creating a vicious cycle. Each condition worsens the others, and the kidneys are caught in the crossfire. The scariest part, you might feel fine until the damage is advanced. Understanding why kidneys fail is the first step to protecting them. It's not just about avoiding certain pills or drinking more water. It's about recognizing that your daily choices quietly shape your kidney health. And that's why, in the next section, we'll talk about the first sign your kidneys might be crying for help: changes in your urine. Your urine can tell you more than you think. It's one of the first and clearest windows into kidney health. When kidneys begin to struggle, they can't filter waste properly, and the signs often show up in the toilet bowl long before you feel pain. Paying attention to changes in your urine can literally save your life. Foamy or bubbly urine is a red flag. This often points to protein leaking into the urine, a condition called proteinuria. Healthy kidneys normally keep protein in your blood, but when they are damaged, they start letting it escape. Over time, this silent leak can lead to swelling and more serious complications. Blood in the urine is another warning sign. It can look pink, red, or even brown, and it's never something to ignore. While it might come from something less serious, like an infection or kidney stone, it can also signal more advanced kidney damage. Either way, it's a message from your body saying, pay attention. Color changes also matter. Urine that is very dark, almost tea-colored, can mean dehydration or the presence of waste building up in your body. On the other hand, urine that is consistently pale and diluted might mean your kidneys are losing their ability to concentrate urine. Both extremes deserve a closer look. Even frequency holds clues. If you find yourself running to the bathroom far more often, or barely going at all, your kidneys might be struggling to keep up. Changes in urination patterns, especially when combined with other symptoms, are often one of the earliest signs that something is wrong. Your body whispers before it screams. Urine changes are those whispers, subtle, easy to miss, but critical to notice. And if you ignore them, the kidneys will find another way to tell you they are in trouble. That's when the second sign often appears: swelling in unexpected places. When your kidneys slow down, your body starts holding onto things it shouldn't, especially fluid. This extra fluid has to go somewhere, and it usually shows up as swelling. Most people first notice it in their feet and ankles, thinking it's just fatigue, age, or even the weather. But persistent swelling can mean much more. The medical term for this swelling is edema. It happens when your kidneys can't filter out excess salt and water properly. As fluid builds up in your tissues, your shoes may feel tight, your socks leave deep marks, and your rings might suddenly not fit. These aren't just inconveniences, they are warnings. Swelling doesn't stop at the ankles. It can creep up to your legs, hands, and even your face. Some people wake up with puffy eyelids, thinking it's from a bad night's sleep, when in fact their kidneys are struggling to keep balance. This swelling can change day by day, but it never fully goes away. Many people dismiss swelling as just getting older. That's a dangerous assumption. While aging can cause mild puffiness, kidney-related swelling is more pronounced and doesn't resolve easily. Ignoring it means ignoring one of the clearest signs that your kidneys are quietly in distress. Why does this happen? Because the kidneys play a key role in removing extra fluid from the blood. When they can't do their job, the fluid has nowhere to go. It seeps into tissues like a sponge soaking up water. Over time, this overload puts pressure on your heart, lungs, and joints. Swelling is your body's way of saying something isn't right. If your feet, hands, or face are persistently swollen, it's not vanity, it's a signal. And when ignored, it often leads to the next, more exhausting sign of kidney trouble: relentless fatigue and weakness. When your kidneys aren't working well, your entire body feels it. One of the clearest and most frustrating symptoms is extreme fatigue. This isn't the usual tiredness after a long day. It's a deep, persistent exhaustion that doesn't improve with rest. People often describe it as feeling drained all the time. Why does this happen? Damaged kidneys produce less erythropoietin, a hormone that tells the body to make red blood cells. With fewer red blood cells, less oxygen reaches your muscles and brain. The result? Anemia, and with it, constant weakness and a lack of energy to do even the simplest tasks. Fatigue affects more than your body. It clouds your mind, making it harder to focus, remember things, or even hold conversations. This brain fog can lead to frustration and anxiety, especially when people don't understand why they are feeling so off. Many people mistake this symptom for aging or stress. They think, "I'm just getting older," or "work is wearing me out." But when fatigue becomes overwhelming, it's not normal, it's a signal. Your body is struggling, and your kidneys could be the reason. The exhaustion from kidney issues can also trigger a vicious cycle. When you're too tired to move, you exercise less, lose muscle strength, and feel even weaker. This creates a downward spiral that can be hard to break if the root cause, the kidney problem, isn't addressed. Fatigue is a silent thief of quality of life. It creeps in slowly, taking away your energy, motivation, and joy. And while you might learn to live with the tiredness, your kidneys won't stop sending signals. The next one often shows up where you least expect it, on your skin, as relentless itching. When your kidneys begin to falter, your skin might start speaking for them. One of the most uncomfortable and overlooked symptoms of kidney trouble is intense itching. This isn't the occasional dryness that a bit of lotion can fix. It's relentless, deep, and often worse at night. What causes this maddening itch? As kidney function declines, toxins and waste products start to build up in your blood. Among them is phosphorus, which can accumulate and irritate nerve endings in your skin. The result is pruritus, a type of itching so persistent it can drive people to scratch until their skin is raw. It's not just a surface problem. Many patients describe the itching as coming from under the skin, as if it's impossible to reach. Creams and moisturizers provide little to no relief because the real issue isn't dryness, it's what's happening inside the body. This symptom can be surprisingly severe. Some people lose sleep, develop rashes, or even injure themselves from constant scratching. The frustration can lead to mood swings, irritability, and a feeling of helplessness, which only adds to the burden of kidney disease. Many dismiss this itching at first. They blame allergies, soap, or aging. But when the itch becomes constant and nothing helps, it's a sign that something deeper is going on. Ignoring it only allows more toxins to build up, worsening the cycle. When the skin starts to scream, the kidneys are already struggling. And as uncomfortable as this symptom is, it's just one piece of the puzzle. Often, the very next sign that something is seriously wrong appears in the stomach, with nausea, vomiting, and a sudden loss of appetite. When the kidneys can't do their job, the stomach often pays the price. Many people with declining kidney function experience nausea, frequent vomiting, and an overall loss of appetite. What once were favorite meals can suddenly seem unappealing, and eating starts to feel like a chore. The cause is something called uremia. As waste products build up in the blood, they irritate the stomach lining and affect the brain's nausea center. This toxic overload doesn't just make food unappealing, it can leave a constant sour taste in the mouth and a feeling of fullness even without eating. Vomiting is another major warning sign. Some people find they can't keep food down, while others wake up queasy every morning. This constant cycle of nausea and vomiting drains energy and can lead to dangerous weight loss over time. Appetite changes can be subtle at first. You might start skipping meals without realizing why, or certain smells may suddenly turn your stomach. Over weeks and months, this reduced food intake can lead to malnutrition, further weakening the body when it most needs strength. This symptom affects more than the stomach. It affects the spirit. When eating becomes unpleasant, social meals and family gatherings lose their joy. This emotional toll often leaves people feeling isolated and frustrated, not understanding that their kidneys are at the root of the problem. Nausea, vomiting, and appetite loss are the body's way of saying the toxins are building up. And while these symptoms are alarming, they lead us to the next signal the kidneys send, one that feels much heavier: shortness of breath. Breathing shouldn't feel like work, but when kidneys fail, it often does. Shortness of breath is one of the most unsettling signs of kidney trouble. It can start subtly, a little breathlessness when climbing stairs or walking across a room. But over time, even simple tasks can leave you gasping for air. Why do kidneys affect breathing? One reason is fluid overload. When kidneys stop filtering excess water, that fluid can build up in the lungs. Imagine trying to breathe with a sponge soaking your airways. It's exactly that, heavy and suffocating. Anemia plays a role too. Failing kidneys produce less erythropoietin, leading to fewer red blood cells. With less oxygen traveling through your body, every breath feels like it's not enough. It's not just tiring, it's frightening, especially when you can't explain why you're so out of breath. This symptom often creeps up slowly. People blame it on aging, weight gain, or lack of exercise. But when you can't catch your breath lying in bed, or you wake up gasping at night, the problem goes far beyond being out of shape. Shortness of breath can also trigger panic. Feeling like you can't get enough air is terrifying, and anxiety only makes breathing harder. This vicious cycle leaves people exhausted, restless, and scared, not realizing their kidneys might be the silent culprit. When every breath feels heavy, it's the body's desperate plea for help. And while shortness of breath is alarming, it often leads to another sign of kidney failure, one that shows up when you finally try to rest: sleep disturbances and painful cramps. When the kidneys begin to fail, even rest becomes difficult. Many people notice they can't sleep through the night anymore, waking up restless or unable to fall back asleep. This isn't just ordinary insomnia, it's your body struggling with internal imbalance. The reason lies in the toxins that healthy kidneys would normally remove. When these toxins build up, they disrupt nerve signals and create a constant sense of unease. The body can't fully relax, and nights become long and exhausting instead of restorative. Muscle cramps are another major clue. These painful spasms, often in the legs or feet, are linked to kidney-related imbalances in calcium and potassium. The cramps can hit suddenly, sometimes so sharply they wake you out of a deep sleep. These nighttime struggles have a ripple effect. Poor sleep leads to daytime fatigue, irritability, and more health issues. And when cramps keep interrupting rest, your body never gets the recovery time it needs to function well. Many dismiss these signs at first. They assume stress, aging, or too much activity is to blame. But when sleep disturbances and cramps become constant companions, it's a sign your kidneys are struggling to keep your body balanced. When the nights get harder, the warning signs are getting louder. And that brings us to an important question. What should you do if you're experiencing these symptoms? The final part of this video holds the answer, and it could change the way you approach your kidney health. If you've recognized even one of these signs in yourself, don't wait. Kidney disease doesn't announce itself loudly until it's advanced, and by then, the damage may already be serious. The earlier you act, the greater your chance of protecting your kidney health and avoiding lifelong complications. The first step is simple but crucial. Talk to a nephrologist. These kidney specialists can evaluate your symptoms, order the right tests, and catch problems early. A simple creatinine test and urine analysis can reveal more about your kidney function than guesswork ever will. Don't ignore your lifestyle habits, either. Staying hydrated, managing blood pressure and blood sugar, and avoiding overuse of pain medications all play a major role in preventing kidney damage. Small, consistent choices today can spare you years of suffering tomorrow. And remember, these signs don't always mean kidney failure is inevitable. Sometimes, catching issues early allows for treatment, lifestyle adjustments, and even reversal of damage. The key is to listen to your body and respond before whispers turn into alarms. If you've seen these warning signs, consider this your wake-up call. Schedule that doctor's appointment, get those tests done, and start making changes now. Your kidneys work for you every second of every day. It's time to work for them, too. Because in the end, caring for your kidneys is caring for your life. Don't ignore the signs. Don't wait for things to get worse. Take action today, and give your body the chance to keep working the way it was meant to.